we we start with a um, expectation of something happening, or rather what we want to happen, and then formulate the methodology and the means to achieve it.
Very nice. Did you get everybody what he said? It's not a null hypothesis or any other hypothesis. It's where you want to reach and how will you reach. What change you want to see. So what was Ashwini talking about in the second session? Something like indicator. Please mute yourself if you are not participating. She was talking about indicator matrix and other things and all. Am I right?
Madam, indicators I would be covering today. So last session we covered outcomes chain and evaluation question.
So why outcome chain? Why you have to make the outcome chain?
Ma'am will be able to understand what are our short-term, intermediate, and the final outcome, so that we can reach to a final outcome through the processes of what is our short-term goals and the intermediate goals. So this is a chain wherein which reaches to our ultimate goal, ultimate outcome of reaching what we expected out of our project.
Anyone else wants to add?
Ma'am, it is a blueprint how to reach the final outcome. What is the way to reach the final outcome?
Very nice, Mirna.
Madam, also what will change, who will change, and what are the methods to evaluate the change or measure the change?
Yeah. And what about evaluation questions?
Ma'am, evaluation questions basically indicates exactly what, where, and when, and how it is being processed. And that will give you the each segment will give you the answer for the entire methodology which is being implemented.
So she has given you a topic, the two groups. With reference to that, can you make some questions?
For us, it was given the implementation of OSCE for the third year undergraduate dental students.
Anyone attended today's session? Today's educational dental conference session? Anybody attended? There was a session on OSCE also. No. Okay. All right, go ahead.
So in that evaluation questions will be like who exactly is conducting the procedures, what exactly we are expecting, and how it is being processed. So all those things will be explained in this. And that also indicates whether it is a short term or intermediate or the long term. What is it?
Ashwini, you want to?
If I may just clarify, just remember, evaluation question is very specific for a particular outcome. Okay, so when you say that ABC is going to be the outcome of my project, you have to be prepared what kind of question an evaluator can ask you. Suppose you say that the students are satisfied with implementation of OSPI or OSCE in the department, then the question is going to be, are the students satisfied? And what factors? You don't want to stop at only the satisfaction level, yes or no. You would also want to know whether the satisfaction is because of that OSPI, or that satisfaction was that, okay, chalo, kuch time pass karne ko mila, you just sit with your colleagues and do time pass. No. So you would also want to know what were the enabling factors that led to the satisfaction of the students due to implementation of OSCE. So please remember, evaluation question, you yourself are not trying to answer that question when you're writing the protocol. You are thinking of that evaluation question so that when you go ahead with your indicator matrix, you are ready as to what information you would like to collect so as to give, or you become in the position of answering that question. So you have an outcome, and for that outcome, you have evaluation question. Similarly, if you are doing certain activities, the important activities will also have evaluation question. You would say, in your case, you would say conducting OSPI or OSCE station, or the OSCE station would be conducted. Then the evaluation question, was OSCE OSPI conducted in the department? How many students did attend OSCE OSPI? How many stations were, there in the OSPI OSCE? Such type of evaluation question. And then when you try and answer the evaluation question, which is today's topic about indicators, then you are prepared to answer any questions. So you think of evaluation question beforehand so that you don't miss collection of any kind of data when you write your protocol. That's the whole idea of thinking and writing evaluation question when you're planning your study. Okay. Of course, when you submit your protocol for any approval, for example, you don't give them the indicator matrix. You don't give them the indicator matrix. You only think of outcomes, and there are the indicators which would be talking today, and then different methods of finding out or collecting that data. So then that you incorporate in your methodology. Understand, we are doing all this exercise so that your methodology is strengthened. Are you getting it? So that you don't miss anything and you go ahead and do the project, and at the end you realize, अरे इसका questionnaire में ये question तो पूछना ही मैं भूल गई. Why you forgot? Because your indicator matrix or evaluation matrix was not foolproof. You had not thought of that outcome, and therefore you had forgotten to put that question in the questionnaire. To avoid all such things, we made this exercise, especially for educational project, because there is no right or wrong methodology in educational project. In our clinical, it is very sure that you want to evaluate ABC, so you want to evaluate this with a control. So you're very clear more or less as to what you're doing. But in educational methods, most of your data is going to be a qualitative data. And you have to be very, very sure at the beginning when you're planning your study, are you in a position to gather that qualitative data? So to put that component in your methodology when you're building or strengthening your project. And therefore, as a groundwork, you do your evaluation matrix or indicator matrix. I hope I'm clear about the importance of doing this exercise.
Ma'am, can I ask one question?
Sure, go ahead.
Are these evaluation questionnaires available beforehand, and we have to modify a little bit like in the Likert scale, or we have to totally prepare by ourselves only?
1 second. Evaluation questions are not available anywhere. It is your own study. You have or you have identified the outcomes. Now, you may say that I am looking at this outcome. So pertaining to that particular outcome, somebody is going to ask you evaluation. Somebody may ask you an evaluation question. So you as a researcher, before only think of what kind of evaluation questions can be asked for this particular outcome.
Then,
So
ma'am,
there
I
are
have to score also to the question. No? So, how I am going to validate the scoring for this
How you
question?
are going to do it comes under indicator, not the question. The question would be if it has happened, and the second type of question would be what were the factors or why did it happen. Understand the concept about evaluation question. These are not questions wherein you as researcher are going to sit and answer and write down the answers. You have to think so that when you plan your indicators today, you can cross-check whether my indicators are answering the evaluation question which I thought of in last class.
I think it will become more clear today.
Clear when I start with the session probably. And then again, if it's not clear, we can discuss it further. Is that okay?
Yes, ma'am. I would like to request you to brief the whole topic after once the whole session is over, like from the previous one. No? So we can recapitulate what have been taught.
Yeah. Ashwini, we can even have a session later when they choose their topic and they want to work on it, something like that. I think after
Sure.
the NCHP, after that.
Sure.
I am not in Mumbai during that time.
Achha, you're not attending NCHP?
Because my Guruji's 80th birthday.
Achha.
So last year all the way I went to Dehradun.
Okay. This year it's Mumbai. Okay. Fine. So can we start today's session? Yeah?
Yes,
So I'll start sharing the screen.
Yeah.
Fine. So now we start with our third session on educational project. I always acknowledge my guide and mentor, Dr. Rashmi Vyas, and my PME team from KM, Dr. Praveen Munira and Rakhi. So just a recap, I think quick 2 minutes I'll spend on recap. If you remember, session 1, we discussed the importance of doing a particular project. So in that, we discussed or we identified the problem. Why? What is the problem you would want to solve by doing educational project? And that also included the context in which that problem is existing. Then we also discuss the outcomes. What are you expecting if you try and solve that problem? So what are going to be the short-term, intermediate ones, and the long-term outcomes of your project? And if you want to reach to that long-term outcome, then how are you going to go about can be found out with the help of concept map or the outcomes chain. And then we also started working on the evidence that will be used to document your journey and the success, which is told by using indicator matrix or evaluation matrix. Last time we discussed the outcomes chain and evaluation question. In today's session, the objective would be the fellows would be able to identify the indicators, data source and data collection methods for the project outcomes and describe the methodology along with the timeline for the project. So let's start with the indicators. I'm sure the table is familiar. Last time I had showed this thing to you all. So we have discussed the outcomes and evaluation question. Now in today's session, let's talk about indicators. So what I mean by indicator, so as the name suggests, this would indicate that the outcome has been achieved. You may say that the outcome of my project is XYZ, but then what would indicate that yes, you have achieved this particular outcome by doing a particular project? Those are indicators. And always remember, indicators have to be smart. What do you mean by smart? They have to be specific. So for a particular outcome, you would have a specific indicator for that outcome. The indicator has to be measurable. You're going to measure it, right? So it has to be measurable. It has to be achievable, something which you can achieve, and realistic and within the given time frame. So remember, whenever you are drafting or writing down the indicator, think whether they are smart indicators. They are specific, measurable, achievable, realistic, and timely. Let's take one example. So there's this project of a fellow titled Integrating Information Technology in Learning and Teaching. Now this is quite old project, I would say. Now everybody knows about integration of IT in learning and teaching, but forget about that. We will just concentrate on the example. One of the short-term outcomes of that project was faculty use internet resources. And the evaluation question for that outcome was, did faculty use internet resources? Okay. So if you want to collect answer for this evaluation question, and if you want to find out whether the outcome is being achieved or not, the indicator which the fellow thought was number and percent of faculty who use internet resources. So if you look at this particular indicator, it is very, very simple to actually put, but you don't know what you mean by use of internet resources. So it's not a very specific indicator. So now if you modify the same indicator, the number and percent of faculty who send or receive an email at least 3 times a week, number and percent of faculty who belong to a mailing list, listserv, or online discussion group, number and percent of faculty who access the www at least 2 times a week. I told you this is an old project, but the point here which I'm trying to tell you all is one outcome can have more than one indicator. Okay, but it's not a must that every outcome has to have more than one indicator. I hope you get my point. There could be a situation where one outcome can have one indicator or one outcome can have more than one indicator. When I'm putting it in this particular language, now it is very, very clear what do I mean by internet resource. So I am being more specific while writing the indicator as compared to the earlier indicator which I showed you. Let's take one more example. There was a project where something new was done in the department. So one of the short-term outcome was students are satisfied with whatever the program was, with the program. The question asked was, are students satisfied with the program? And if you look at the indicators, I have put here 2 indicators. One, over 3/4 of the students report that they were satisfied with the program. And the second one which is seen here is over 3/4 of the students rate the program excellent on the 5-point Likert scale. Now, if you compare these 2 indicators, they are giving you the same information. The first one says that students report that they were satisfied, and second one says that students rate the program excellent. There is no right or wrong between the 2. You as investigator would have to decide which one of the 2 you are going to go ahead with, depending upon what methodology are you going to plan further. If you already are planning a questionnaire which is required to gather information about other outcomes as well, and that questionnaire has a Likert scale, then one of the questions would be, I am satisfied with the program, and student will, if yes, then student will mark excellent in that Likert scale. Then in that situation, I would go with the second indicator. But there is no right or wrong between these 2 indicators. So what I'm here trying to tell you is that the indicators can be, or the information about the outcomes can be gathered in more than one ways. It is up to the investigator to decide which one of the 2 you are going to go about. It doesn't make sense gathering both types of information. It's just a waste of resources and energy and time. Correct? Let's see one more example. The same example which we've been talking about throughout our sessions, introduction of ECE in the first year dental curriculum. So few of the short-term outcomes. The first was students are satisfied with the program. Are the students satisfied with the program is the question. And look at the indicator. 80% of the students rate the program excellent on a 5-point Likert scale. The second short-term outcome is faculty is trained in ECE technique. Question is the faculty trained in ECE technique? And what would indicate that the outcome is being achieved or evaluation question is being answered? It is 100% faculty report that they are using ECE technique in their teaching. Now, definitely a question is going to come to your mind. What are these numbers? 80%, 100%, and how do I come to these numbers? Now, these numbers, there is no rule as to what or which number you're going to put in the indicators. It is you as investigator decide which number I am going to go for. Suppose in the first indicator, instead of 80%, I write 40%. Then the third person who's going through my project would say, you are okay only if 40% rate your program as excellent on Likert scale. Then that means you feel your program is not going to be okay with most of the students. On the other hand, if I write 100% of the students rate the program excellent, that means even if 2-3 of the students don't mark my program excellent on the Likert, this indicator is a failure, and that means this outcome is not being achieved. So usually in such a case, usually about 2/3 or 3/4 or 80% of students, faculty is okay to go about. It's neither too less nor very ambitious. But look at the second indicator, 100% of the faculty, because my whole technique of ECE involves the training. The training of the faculty has to happen. If the training of the faculty is not happened, even if single faculty is not trained in ECE, then that my module is not a success. And therefore here I have written 100% that whoever is faculty is involved as a co-faculty in my project, everybody should be trained in ECE. And that's the reason I have put here as 100% faculty report that they are using ECE technique in their teaching. I hope this
Voice
to the
is low,
certain
ma'am.
point. Yeah,
Your voice is low, ma'am.
voice is low. Are you now able to?
No, madam, you are clear, absolutely clear.
See, Mirna, you are internet. Mirna, can you hear me?
Voice is low. Let me join one more time, ma'am.
Okay.
Okay, fine.
Madam, I'm Dr. Narendra. I just want to have a clarification regarding what is the need to put a expected outcome in the first place in terms of 80% or 100%. Why not put it a percentage of students who rate this program excellent and just find out the actual score.
Okay. Suppose you only put percent of students rate the program excellent. But what are you expecting here? If you have 150 students in your program, then what are your expectations? Only percent would be. So suppose you have put 80%, and when you actually carry out the program, if you get 70% or 75%, then you would want to find out the reason why the students are not satisfied.
So that would be a follow-up evaluation question, madam.
That would be that you can put it as a follow-up in your project or in the same project, and that's the reason you don't stop in the evaluation question by asking yes or no, or getting a question where answer would be only yes or no. You also there would be one more evaluation question here. What were the factors that led to satisfaction of the students? So then when you put
or if it has not been achieved, would we also have another question why it was not achieved?
Absolutely. So what factors led to satisfaction would give you that answer. So whoever student has not rated it as excellent would have given some factors.
Okay.
Then you would know why the program was not satisfied, and then you can modify.
Right.
Yeah. Okay.
Thank you, ma'am.
Let's see one more example of the same project. One more short-term outcome is first year UG dental students correlate preclinical subjects and their clinical application. So there were two evaluation questions because this is an important short-term outcome. Did first year UG dental students correlate preclinical subjects and their clinical application? I have put here two indicators for the same outcome. Faculty report that 75% students correlated preclinical topic and its clinical application during Viva. Second indicator is students score more than 80% in the exam questions based on clinical application. Why I have put here two indicators? The reason being, this is very important outcome of this project because the whole project is early clinical exposure, and one of the important basis for doing early clinical exposure is that so that the students start correlating the preclinical knowledge or the basic knowledge with their clinical knowledge. And that's the reason this outcome is extremely important. So I want to gather as much information from the stakeholders to find out how much I've been successful in achieving my short-term outcome. So the two important stakeholders in this project are going to be obviously the faculty and the students. And therefore, I am planning to gather information from both the stakeholders. So I want faculty also to report whether students are correlating. And I want students in the form of, students cannot report because then student would say, yeah, I am doing clinical correlation. Students to kya aisa hi bolega na? But how do I'm ensuring that students are doing it by doing or giving them some test where, they score more than 80% on the questions based on clinical application. So remember, one outcome can have more than two indicators if that outcome is extremely important and you want to ensure that the outcome is being achieved by gathering extra information. The second evaluation question, because this is an important outcome, was what is the perception of the students for correlation of preclinical subject and their clinical application? So here the indicator would be more than 80% of the students mention a particular, they're going to enlist factors, right? So they mention a factor that helped them in correlation of preclinical subject and their clinical application. So when you ask them in a questionnaire, they're going to enlist few factors that, okay, these are the factors which help me in correlating basic science with the clinical subjects. So identifications of those areas becomes, or those factors become important for the success of your project. So that will tell us that whatever you have done as a part of your project has really led to the correlation between the preclinical and clinical. They would say that I was exposed to the cases, the clinical consequences was discussed during the ECE module and so on and so forth. Are you getting it? That would indicate that yes, the students have started correlating, and that correlation is because of introduction of ECE in first year of BDS students. Let's move to the intermediate term outcome. For the same project, higher acquisition of knowledge and skills by UG students during clinical postings. Now it's intermediate, right? A little after some time, they've actually started applying what they have gained. So during clinical postings, due to improved understanding of basic science. The evaluation question here was, did the faculty report that the students answer correctly the clinical question based on basic sciences during the clinical posting? Now they've gone ahead with the dental curriculum. They are exposed to clinical posting. So are they using that correlation of preclinical subjects and clinical during their clinical posting? So the indicators would be faculty report that 75% students answer correctly the clinical questions based on basic sciences during clinical postings. Students score more than 75% in assessment, assessing their knowledge and skills that require understanding of basic sciences. So this is how you're going to formulate the indicators for this. Let's have a look at one long-term outcome for the same project, improve patient care for dental graduates. Question is, did the patient care by dental graduates improve? An indicator would be the different stakeholders which are involved in that dental care. It would be peers, senior, junior, patient, even self-report that the good dental treatment is received by the patient. This, I have put it here. I know it is very difficult to measure at your level, but of course, as I've been telling you since the day one, that ultimate goal is to have some clinical benefit to the society, and then therefore you put your long-term outcomes and the indicators for the same in your project. You may not be able to gather the information with regards to long-term outcome when you're doing the project. So then we just discussed about indicators. Let's move on with the indicator matrix. Let's talk about data sources and data collection method. So gathering data. Suppose I make
If they
a
want to
statement.
ask you anything here, let them ask.
Okay, fine. So any questions?
I think all of you must be having, you can ask very frankly.
Madam, you just told that long-term outcomes need not be part of the our project.
Yeah.
It is not necessary.
No, it's not necessary because this I said because looking at the time point.
Point.
Long-term outcome would take at least 5 to 10 years to achieve. So looking at the time to do your project, it may not be feasible to do it.
So it is more likely that we have to go with only short-term outcomes.
For your project, only short term, but you can of course continue the project and gather information about intermediate outcomes.
Okay.
Right? Yeah.
Madam, do we need any clearances for doing such a project?
Yes.
Yes. Yes.
Ethical.
Because
So
most of your stakeholders would be vulnerable population. Most of your project would involve students, and students are vulnerable population. So ethical clearance is required.
So in that case, the protocol may have to include all the future measurable outcomes also, if you need to continue the project.
It depends for how much are you taking ethical clearance for. Are you taking ethical clearance only for the next 6 months, which is your project for this fellowship? Or
Okay.
you would want to continue the project throughout and you are taking ethical clearance for the long-term project?
Okay.
Right?
Thank you.
So it depends on what have you thought, what your thought process is with regards to your project. Yeah.
Thank you.
Did everybody get the question what Padiyar asked? Did you get the question what he asked? Yeah. You can ask as many questions as possible so that everything gets clear. And every time we will update you, don't worry.
Ma'am, these indicators that we are mentioning, these are imaginary thing that we are putting across while we making the protocol, because we are mentioning the percentages. All these things is imaginary because we do not have any data.
It's not imaginary. It is that what you want to reach.
Okay, ma'am. That means we would be able to reach this thing. So to reach this, what all we are making up the steps, that is what being indicated here.
Yeah. Supposing you do not reach your short, as she said, you say that 100% faculty should be trained and they should be able to conduct the EC. Those who are involved with the CCS, second year, first year programs and all. So if there are some faculty which say that, no, I have not been satisfied with the training, you need to rethink and do it for them. And the students are not showing that kind of results. So probably in the intermediate, you will see here it's a project where you can go back and forth. It is not a clinical research. This is not imaginary, but it is where you want to reach. There is a difference between possible and plausible. What you wish. So what, and that wish is not just a wish. Wish is that change you want to see. And as she said, The long-term outcome will take, supposing 10 years, 8 to 10 years. So if at all you're going to keep on collecting gathering the data, you must write in your ethical committee permission that we are going to collect this data. Some are not, you are not able to have the same students, but certain projects it is possible to have the long term, because we said last time, it is the improvement in certain things what you are measuring. It has to be measurable. It has to be measurable. Every time you cannot say the long term is the patients are treated. You cannot say that there are community benefits and all. This cannot be measured. If it's benefited and how much and how is that there is a reduction in the periodontal diseases because of the community work that you have done, then you can say that yes, it is. See, as you do the project now, things will become very clear. I think this time she has explained more than what you can actually. Padiyar asked initially very good way of telling what is the difference between clinical and I think somebody else also added a very good question. Mirna asked some things which we are going to answer, so things will become easier. Mirna asked, what about the evaluation question?
Doubts are clear now.
Yeah, thank you, Mirna. Thank you, Mirna.
Madam, can I add just one more thing? Like in an observational study, they say that you go ahead with an observational study and come to a hypothesis. Here also, do we have situations where once having done a project, we can come with a hypothesis that by doing this, this can be done, this can be achieved, something like that?
You already have a presumed hypothesis. You have that what change you want to see.
Okay.
You already have. Whether you're able to reach that or not depends upon how you have.
No,
yeah.
I am asking about the cause and effect, whether that has to be established.
You are going retrograde, no?
No, I think, Dr. Pariyar, what you are trying to ask is that those type of projects are called as needs assessment project.
Okay.
Where suppose something is already going on in your department and you want to find out how well the things are going in your department. So probably you take a survey of your stakeholders and you find out whether there is any, is there a change or there is a need to change anything which is going on in the department. So then you're observing something which is already going on in the department. You gather data from the stakeholders, you analyze that data, and then you say that, okay, fine, whatever is going on in the department, out of that, A, B, C is okay, but X, Y, Z needs some change. So then I would plan a study where I would try and change that X, Y, Z. So this is also can be an educational project, which goes under the umbrella of needs assessment.
Yeah, but so here I would like to add, Ashwini, that any project you cannot just start on your own. There has to be a need for that improvement, improvisation, or where you want to reach. And this is the way to take all stakeholders together. It could be just a focus group, but focus group is more difficult because to record, you have to take out the themes and other things and all. We will talk about the Google form and how to collect the data and all these things we will be talking to you. I think next time we can do that.
So I'll just go ahead.
Yes.
I was talking about data. So if I say that it is too cold in the room, right? So how did I come to this conclusion? This is the room, the picture which you can see. So how did I come to this conclusion? I need to have some data to conclude and say that it is too cold in the room. So there are different ways of doing it, right? So I checked the thermometer and temperature was very low. I shivered, or I saw some people shivering. People in this room told me that they were feeling cold, or I saw people putting on layers of woolen clothes, right? So there are different ways of gathering data so that you come to some conclusion as to whatever is the situation. So you need to have authentic data to come to a conclusion and say that, okay, fine, this particular outcome is being achieved or not achieved. What could be the data sources for gathering the data? The sources could be your students, faculty, patients, other health professionals, or certain records, right? So you can have primary data or secondary data. So when I say primary data, you collect the data directly from that data source. Suppose I want to collect some data from the students, I directly ask students certain question. So I'm collecting primary data. And secondary data is I take help of some other sources. Suppose I say that students have, achieved certain things in the exams. So I'm not going to ask the student directly for the exams. What I'm going to do is I'm going to give them the exam papers. I'm going to analyze those documents, and then those documents become my data source. So what I'm trying to get here is the secondary data. So data source could be either primary or secondary. There are different types of data collection method. It could be quantitative or it could be qualitative, right? The quantitative methods are you can obtain using survey or questionnaire or performance data like performance of students in the exams. While qualitative data, you again survey questionnaire could be of both types, right? So you have survey questionnaire, structured interview, focus group discussion, which Dr. Nagda was referring to, and certain observation. I'm sure you're going to have a separate session on different types of qualitative and quantitative methods of analysis, and the terms and the use of appropriate method would be clear once you have those sessions. Let's clarify the data source and data collection method by using certain examples. The same one. I have not put here the column for evaluation question only for the sake of the space constraint. Otherwise, that evaluation question column has to be there. So let's take the first short-term outcome. Students are satisfied with the program. And the indicator for that was 80% of the students rate the program excellent on a 5-point Likert scale. So what could be the data source to obtain this particular indicator? Can anybody say so? Quickly.
Ma'am, we can attribute the Likert scale of agree, disagree.
Yeah, but what could be the data source? Data
Survey,
Likert scale would be data collection method. Source कहाँ से लोगे आप तुम data ये?
students directly.
Students से, right? Simple. Data source is student, data collection method is survey or questionnaire. The second indicator, 100% faculty report that they are using ECE technique in their teaching. What could be the data source?
Faculty.
Faculty. And data collection method?
Survey, questionnaire.
Survey, questionnaire, interviews. You plan as per your need, right? The next one, faculty report that 75% students correlated preclinical, etc., etc. So what is the data source here?
Yeah, it will be faculty.
Faculty.
And student both.
The second indicator, students score more than 80% is exam scores. So this is secondary data source. You are not directly asking the student. You are checking the exam scores. And what would be the data collection method? Analysis of that document would actually give you whether the indicator is being achieved or not. Okay? The intermediate one. The first one, faculty report that 75% students answer correctly. What would be the data source and data collection method?
Faculty.
Faculty, data collection.
Survey questionnaire. Interview.
Survey questionnaire, interview. If you have just 2-3 faculty involved, then giving them survey questionnaire doesn't make sense. You can just interview that faculty. Okay, depends on you, right? Next, students score more than 75% in assessment. So what could be the data source here?
Exam scores.
Exam scores and analysis of the document. Correct? So once you've written your indicators properly, data source, data collection method comes to you easily. Let's talk about long term. Peer, senior, junior, patient, self-report that good dental treatment is received by the patient. So what could be the data source?
Same.
All these stakeholders, peers,
Yeah.
senior, junior, patient, self. right? And data collection method, how are you going to take it or collect the data? By giving them questionnaire,
Yes.
right? Okay. So what have we discussed till now? We've discussed indicators, data source, and data collection method, right? So now we go to the breakout rooms. Again, it's a self-managed group. You'll have 15 minutes in the small group. What are you going to do? The 2 projects has been allotted to you. You're going to select key short-term outcomes, intermediate and 1 long-term outcome, develop indicator for the same, and then enumerate data source and data collection method for the above indicators, right? You all know your projects. So I'll stop sharing and I'll take the questions before we go for breakout rooms. Any question,
Madam,
anything which you have not understood, please go ahead.
Madam, what do you have to do in the breakout session once more, madam? The points
You
like
have till now
short-term
worked
outcome.
on, till now you have worked on outcomes and evaluation question, right? So in today, what you're
Yeah,
going to
ma'am.
do, pick key short-term outcomes, maybe 2 or 3 short-term outcomes, develop indicators for those outcomes and data collection method and data source. Similarly for intermediate and long-term outcome. You already have outcomes and evaluation questions. Today you're going to work on indicators, data source and data collection method. I hope I'm clear.
Yeah, madam.
Yeah. So can we now open the breakout rooms for 15 minutes?
Okay, madam.
Yeah. 15 minutes, huh?
Hello, ma'am. Hello. Hello, Gauram sir. I think I have been appointed in another group. I'm supposed to be in a group 2.
We'll just ask
Hello.
the admin to move you back.
Yes, sir.
Just
Thank you.
Samek,
Yes, sir. हाँ मैं
हाँ कहीं नहीं हाँ बस हाँ ओके
एक मिनट में ब्रेकआउट रूम बंद हो जाएगा ना?
हाँ जी मैडम, हाँ.
ओके.
Close the breakout room, na? Hello?
Yes मैडम.
अभी क्लोज करने का है ना?
ना ऑटोमेटिक हो जाएगा. 54 सेकंड्स बाकी है. ऑटोमेटिक सब लोग आ जाएंगे.
भले. સમીક,
मैडम. Yes मैडम.
નામ શું રાખ્યું બચ્ચુનું મને કીધું હતું?
Jancy.
સ્પેલિંગ?
JENSI.
વેરી ગુડ, જેન્સી. અને બરાબર છે ને હવે?
હા, અત્યારે રમે જ છે.
વેરી ગુડ.
Okay, so welcome back to the main room. So, who's going to report group 1?
Ma'am, I'll be presenting.
Yeah.
So for group 1, the topic was teaching communication skill to third year BDS students. And we have written 2 short-term outcome. Our first short-term outcome is student confidence has improved. For this, the evaluation question is, has the student confidence improved? The indicator is 80% student rated that they are confident in communicating with the patients. Here the source of data is student and the method of data collection is questionnaire. Our second short-term outcome is better understanding of the treatment procedure by the patient. Here the evaluation question is, did the patient understand the treatment procedure properly? The indicator is 90% patients were able to understand the treatment procedure. The sources of data was patient and the data collection method was patient feedback form. The intermediate outcome here is...
If I may interrupt, very good attempt. Very good attempt. Can you have, for the first outcome, increase in confidence? You said students report that their confidence improved, right?
Yeah.
Can you have some more indicator which would be more reliable? This is a good indicator. I have no doubt about it. It's not wrong. But
We can say that they have little difficulty. Their body language was showing
No.
no. So it is, imagine I am a part of the study and you are asking me, did your confidence improved? Am I going to say my confidence is not improved? So is there any better way of collecting data for the same indicator or for the same outcome?
Okay. Did the patient understood your method? of-
What about faculty?
Okay.
Can you have some kind of assessment with the students? Can you have some OSCE stations where there is a communication station and then the faculty reports that yes, communication student was confident while communicating?
Yeah, we can also add that, ma'am.
Yeah. So as I said, you are not wrong. You are not wrong. Okay. But this is a more reliable indicator of faculty reporting. Okay.
Okay, ma'am.
Right. Go
Okay.
ahead, Nirna, with the intermediate ones.
Okay. So the intermediate one is better decision making by the patient, and the evaluation question is, was the patient able to make a better decision? Then the indicator is 90% patients were willing to go ahead with the proposed treatment plan. The sources of data is the patient, and method of collection of data is questionnaire. And
Okay.
ma'am, anything you would
Fine.
like to add here?
No, I'm okay. I'm okay. What have you planned the same for long term?
No, ma'am. For the long-term outcome, we have decided that it is improved patient care by the third year student. The evaluation question is, did the patient care by the third year students improved? The indicators are more than 80% students scored well in their practical examination during the practical or clinical examination.
My only doubt here is when you say long term, it is actually the result which you actually see in the community.
Okay.
Okay.
Ma'am.
So it
Okay.
takes time.
Hmm.
So what you're talking about, third year BDS students would probably fall still into intermediate. It's a transfer which they have started using when they are coming in contact with the patient in third year or fourth year. Right? So your
topic for the third year. So would you should I change this to the interns like this when this third year student will be converted into interns?
That
The
was
result will be better.
not long term.
or you can put it as BDS practitioners.
Okay, ma'am. Okay.
Okay, interns you can still put it into intermediate. You have taught them communication, and the effect you are seeing when they become intern, when they start communicating with the patient, your outcome is not wrong, but probably that would be the intermediate outcome and not the long term. You would see it probably in the PDS practicing physicians.
Okay. Then the
Okay.
evaluation, yes, ma'am. Then the evaluation question is, did the patient care by the UG students improved? Here I am omitting the third year. The patient care improved for the UG students? Did the patient care by the undergraduate students improve?
No, now you say that the patient care by the physicians or dentists,
Okay,
because now they have become dentists, right?
Okay.
Yeah.
Then the indicator is how to indicate, ma'am. We have written actually 80% students scored more in the practical exam.
That is see.
No, then there won't be any assessment. Okay. Then it's only a questionnaire. You can ask the patient, who's the main stakeholder here. Let's say whatever 80% or 90% of the patients report that the dental care or whatever was your outcome has gone well, or they've received a proper treatment, and it would be a questionnaire. Okay,
And
it will be the exam.
it will be a student. It will be a patient feedback form. Then after that.
Yes, a questionnaire or a feedback form. Very good attempt, I must say.
Ashwini, can I just intervene?
Yes, ma'am. Sure,
As
madam.
she said, it's only for the students, supposing not the practitioner. Then incrementally every year, if you do that, that communication skill, patient misunderstandings and arguments and other things, and patients generally are satisfied with their feedback. That can be analyzed over a period of 5 to 7 years. And then say the institution has really taken care. And communication has very different aspects.
Yeah,
So
correct.
by and by, Nirna, you will make a more focused question. I'm sure of that. Yeah.
So basically here what has happened is I have given you a large umbrella under communication skill. Now when you actually, if at all you want to explore communication skill as your project, then you have to decide which part of communication you are going to take up as your project. Then the outcomes would be more refined. Okay. Because as Madam said, communication is a large umbrella. You have to take a part of it as your project if you decide to do so. Fine.
Actually, ma'am,
So
our
what-
group mates got
I
confused
have a
with
doubt.
that. We are dealing with the third year students, so we got little confused.
Exactly, madam. Madam, the
But third year
third year
students
students,
also
can
begin
we
early.
change the stakeholders to? Hello,
Yes.
Yes, go ahead.
madam. The stakeholders in our project was third year students. Now, by the time we are
Correct.
coming to the long term outcome, can the stakeholders change to like interns or practitioners?
Yeah, of course. Those in the long term कभी होता है? Long term will happen after 5 to 10 years. तो उसके लिए आपका third year
Okay.
BDS students have now become practicing dentists, na?
Okay.
Correct? Yeah. Okay. Fine.
Okay.
So very good attempt. Can I move to the second group, group 2? Who's going to report?
Ma'am, me.
Go ahead.
The topic is implementation of OSCE in dental curriculum. Is our topic. We have listed 2 short-term outcomes. First one is student satisfaction students are satisfied because of the fairness in exam process. The indicators what we have got is 80% of the students report that their satisfaction.
Okay.
Data is collected from the students and questionnaire is the method of collection. How we have done.
Okay.
Second short term is faculty reported that students are more confident.
Okay.
Indicators, faculty report that 80% of the students are confident. We have collected the data from the faculty and by interview method.
Okay. Are these going to be your key outcomes, key short-term outcomes? Again, I'm giving you benefit of doubt because probably you have not read in detail about OSCE or OSCE. Yeah, go ahead. Let's come back. We'll talk about your intermediate ones.
For intermediate, students perform better in all clinical posting in the final year compared to the previous batches. Indicators, 75% of students showed improvement in scores compared to the previous batches. We have data is from the exam scores, and we have compared 2 years exam scores were analyzed for this data collection.
Okay. Was your intermediate outcome indicator SMART? SMART is the one I showed you. Specific,
measurable, achievable, realistic, and timely.
Yeah. So you want to say that your students score better in all clinical subjects as compared to previous years.
Where OSCE was not there.
Absolutely. But you're talking about all clinical subjects.
Yes.
So just think. It may not be too specific and it may not be realistic.
Yeah, implementation of OSCE across all subjects also is challenging in 1 year.
Yeah.
So we can limit to prosthodontics?
Yes.
Yes. Because when you are doing a project, you are taking a part of prosthodontics, right? So as an intermediate one, maybe the whole system of your specific subject OSCE is being implemented. Okay, fine. What is your long-term outcome?
Long term is OSCE in dental curriculum leads to increase in pass percentage of students. And for that,
Okay.
5-year
Remember
previous
one thing.
data is
Remember one thing, your long-term outcome. Why are we all working in this health, what should I say, health system?
Healthcare.
So that ultimately our community is benefited. By your students scoring more marks, is the community going to get benefited directly?
no.
No. And OSPI on OSCE is going to be a part of your assessment process. So students passing with more marks need not be directly related to that part of OSCE. So first of all, it cannot be a long-term outcome. Long-term outcome has something to do with the health improvement. It has to have a link to the health improvement. Correct? So then in this case, that means you have to revisit your outcomes chain and see how do you, from your intervention, reach to your long-term outcome.
Okay, ma'am.
Okay? So I think you work on that area again.
When you say OSCE, it is a performance testing, and you have the scope of various stations to check various levels of cognition and performance also. So what will improve is the student's understanding of the subject, his performing, and his skills will improve. That will help him to be a good clinician. And in the long run, that will help his confidence to being a practitioner. So who will be benefited? The community.
Yes, patients are going to be made.
Actually, I'll tell you, those who do very academically well know, many a times they are not able to translate that into the practice. You have to be street smart in practice also. But that was joke apart. But you have to be good in your work. If at all the patient is caused pain, or wrong diagnosis is done, or the skills are such that it takes too long for you to do that implant, then it is affecting your practice. So it helps the student definitely, but helps the community.
Madam, may I just add? I do agree that our group formulated all these outcomes without properly knowing the scope of OSCE in our education system.
Yeah.
That is the first point.
OSCE
Secondly,
will be taken when it is a assessment module, and that
yes,
will come after 4, 5, 6 months.
yes, ma'am. And another thing is whether OSCE, which is actually an evaluation tool, will it have any bearing on the training? Because training comes first.
There
Evaluation
are
is later. So if the students are not trained properly in the first place, and just because evaluation system has improved, will it have any long-term effect?
Always, when next classes, you will come to know the learning has to align with assessment. Assessment and learning go hand in hand. If the training, if I do by just rote learning, by hearting, I can't then ask you critically evaluate, etc. So that here teaching learning itself is such that you go from knowledge, understanding, just remembering, to application, analysis, synthesis, creating, etc. So accordingly, the teaching is also done with the help of direct observation of procedure for performance, or maybe you are showing a mini clinical examination. The students are shown how every step of impression making, the checklist, how did he select the tray, impression material, how it was manipulated. He understood about the material science, the chemistry. He made the impression in such a manner it didn't impinge on the tissues. He recorded find. So these are the checklist. This is how you improve teaching and assessment. What you teach, accordingly the questions will be made. And students will slowly grow also. But it's not that we are not inspecting what the students don't know. There are many students who don't know, and we want to test only that. That is a little different type of a teacher. But here we want to know really how much he knows, and how much can be added.
So, in that case, madam, my question would be, will OSCE or OSPE have a direct bearing on the long-term benefits for the society?
It will, no? Because see, in objectively
Just by improving
structured,
the evaluation.
I'll tell you, OSCE is objectively structured clinical examination. In prosthodontics, in the final year, if the or maybe in the postgraduate, if the student has OSCE stations, maybe 20 stations, and there you are certain no identification is given in OSCE. That can be have so many other tests. Here it is
Yes.
performance test, little bit of higher level of if you want to shows how, does how, that is also okay. But then accordingly you will keep the procedure. For example, even if a patient goes into syncope, how will he revive the patient? There will be nobody so that he doesn't get scared. There will be only a camera which the examiners may be watching, or that could be just a recording. So it depends upon how he does the head low position. What is it that he is making the patient do? How does he examine the BP? Or maybe there is an emergency. These are all can be also tested in us. And also, if you want to have an OSCE, not as a station, but as a procedural OSCE, that will become actually DOPS type only, that you want them to prepare the tooth for certain, partially, whatever, here we should never say that he's going to prepare the tooth for maybe a ceramic or something like, because that's giving an answer to him. It's the situation and how he does. So this will directly improve the patient, the students. The assessment drives education. Assessment literally drives education. So when he knows that उसको टेस्ट ए बी सी डी का आंसर करना है, वो जाके वो ही सब पूछेगा क्वेश्चन टीचर को, वैसा ही सीखेगा.
So his learning will automatically improve because he knows that he'll be assessed on those.
And I am not saying OSCE is the only method. There are multiple tools.
Yeah.
The present examination system doesn't use multiple tools. For example, if there is a horse, there is a hathi, there is a lion, and there is a crocodile, and you said 1, 2, 3, run 100 meters, horse will come first, but the hathi can take a heavy load. You never gave him an opportunity. उसको एक ही टेस्ट से फेल कर दिया तो कैसा चलेगा? और crocodile can swim, and there are so many other things he can do. A monkey can jump. So multiple methods. So probably in one test he doesn't do well, in another test he does well. Assessment में सब कुछ आएगा आपका. आपको तो curriculum भी चालू नहीं किया. You just joined, but we do this first so that you are understanding that the topic has, and as you take the topic, we are there as mentors. So we'll keep telling you, read this and you do this, or this is the method you do.
Thank you.
Yeah. I can't hear you. You're muted.
Sorry.
No, ma'am.
Okay. So I will start sharing my screen. Let's move ahead. Okay. So we move to the next part of our today's session to appreciate various project management tools and their utility and design Gantt chart for the educational project. So then your project is a project wherein you need to plan something, right? There are two types of planning, something called as forward planning and a backward planning. What do I mean by this? A forward planning means here the quality of final result is more important than the completion date. You have to have very thoroughness in what you do. So that is the critical point. While in backward planning, deadline is important. You have a fixed date and therefore you plan backwards so that if I plan it this way, then I'm able to finish the work on that fixed date. So here, the deadline is more critical than the quality of final result. Let me show you a few examples of forward and backward planning. Forward planning is if you're an author and you are writing a book, right? Most of the times, the deadline is not very sure at the day one of writing of a book. So you just start writing the book. The process is important. The thoroughness in that subject is very important. Or you're doing a PhD. There is no exact deadline that you have to finish by December 23. No, the quality of work is extremely important here. On the other hand, the examples under backward planning, NASA space launch, you have a deadline, you have a fixed date. So you start planning backwards, putting the date in that mind. You have a conference to plan, workshop to plan. You have a wedding in your family. So you know that the wedding is the month of this and this. So I have to plan accordingly. So you go backwards. Or for this fellowship, you have poster presentation. You know, likely my poster presentation is going to be, say, in the month of June or July. So then backward, I need to finish my project by then and you start planning backward. So there are two types of, nothing right or wrong about it. These are just the two ways you can plan any project. So do we need to actually manage your project? Why? What's the need to manage the project? So that you effectively organize things, you manage your time and resources and energy. And for educational project, this is a non-routine or additional activity. You are going to go back to your departments, start doing your project, but obviously this project is going to be an add-on thing to so many other things you are doing routinely. And therefore, you have to have the management plan in place so that all the activities along with educational project go on smoothly. So then what are the different project planning or project management tools which are available? There are three commonly ones. First one is project timeline. Second is project task inventory. And third is Gantt chart. Let's see what is project timeline. So as you can see in the picture, it's just the graphical representation in a form of a straight line, which divides into different duration based on different months. So here, what example you can see, it starts in the month of November and ends after a year. So there are different months written at one end. And on the other side, there are different steps or milestones or events or deadlines which are mentioned. So you have your project launch, you have your IRB submission, and so on and so forth. So it just gives you a broad idea as to ये महीने में ये करना है, ये महीने में ये करना है. Other than that, it doesn't give you anything in detail, right? So that's your project timeline. The project task inventory, it looks something like this. So it actually breaks down the task into different smaller tasks, and it also mentions to whom it is assigned to, other than the date and time of start and finish and the resources required. This kind of project task inventory is mainly used when you have a smaller project to plan. Say, for example, you have to plan a workshop, which is of 2 days or 3 days. Then you would have task written on one side to whom you are assigning that task, what is the start date and finish date with the timings and the resources required, because that workshop is going to be for a smaller period, right? So in that case, you go for management tool in the form of project task inventory. Now, what we are actually interested in Gantt chart. I'm sure many of you may have been exposed to this Gantt chart. This is a graphic representation of your project. It tells you the chronology in what one after the other, what you do in the project, the time, the duration for which each activity is going to be planned, and relationship between the two activities. What are the uses? It is used for planning. So you start and you plan. You know that I'm starting today and my end point is my project poster presentation, which is on this particular month. So I actually do backward planning and I say that, okay, I have to go like this. It is used to communicate your project to your team. So when you go back to your department and you start doing a particular project, you want to involve so many other people from your project. You alone cannot do a project. So then while communicating, while giving them the presentation, you can display the Gantt chart and say that, boss, this is how we are going to go about for our project. Okay. And remember, this Gantt chart is not kind of the end. You can modify, revisit, and change the Gantt chart over the period of time. Okay, so then it also gives you an opportunity whether your project is as per the planned thing or not. Then you revisit the Gantt chart and you can modify, refine if needed. How does it look? Okay. Forget about or ignore these two darkened ones. They have happened by default. How does it look? It has a project title. So whatever title you've been doing, one column or the first column is tasks or activities. So whatever are your broad or major tasks for your project, you just go on enlisting them in a chronological order, one after the other, the way in which you're going to do it, right? Next, this is the time period. Okay. So here I have started from November 21 and I go till November 22. So my project is going to be a year-long project. So I have further divided them into 15 days column. So each column is 15 days. Now it depends. If your project is going to be for a month, then you divide it week-wise. If your project is going to be 6 months, then you divide it for 6 months and either 15 days or 1 week. Depends how do you want to go about doing this timeline. There is no hard or fast rule about it, right? So let's see the example. Introduction of ECE in first year dental curriculum. How does the Gantt chart for this particular project look like? So the first column is making inventory of different tasks. See, the tasks have been written in chronology, right? So prepare the proposal, get EC approval, train the other faculty, select the topic. So when you're writing the task, think, now first what I'm going to do, I'm going to do this. Uske baad what I'm going to do, I'm going to do this. Uske baad what I'm going to do this. So go on listing the inventories or the main tasks of your project. After you've done that, take each task or activity and then where you want to finish, start and finish. Say, for example, preparing proposal, I have planned that I would start around 15th of November and I would complete by 15th of December. So for this 1 month, I would do this activity. Then uske baad, I have this EC approval obtained. Can you see this particular triangle? This is a milestone. So you can, it's not necessary that every Gantt chart should have a milestone. Okay. But this milestone tells you that this is an important step in doing this particular project. And my rest of the activities depends on achieving this particular activity. Unless I get my EC approval, I cannot go ahead with actually doing my project. So you can mark this as a milestone. You can have color codes, you can have multicolor, you can have single color. It all depends on you. See this mark? Okay, this is May month. So this is probably going to be vacation. So I know that in the month of May, everybody is going to be on vacation and nobody is going to do anything. I'm not going to do anything, any activity with regards to my project. So I have marked that. These legends are not universal. You can put your star, you can put $sign and have a legend somewhere else. So these are not universal legends. Can you see this arrow? This means this is interdependency. If you see this this task is administer the test. And the next task, next to next, is statistical analysis. So I know unless I have finished administering the task, the test, I cannot do statistical analysis. So this particular test is dependent on this or linked to this. So I have put the arrow. Again, it's not mandatory to have the arrow here. It's not mandatory that each Gantt chart should have a milestone, each Gantt chart should have a, but the advantage of putting such legends is in a bird's eye view, you know what's happening with your project. Another advantage is when you start putting the activities for different months and then you look at your Gantt chart and you realize in 1 month there are many activities. So then you know, my God, this is the month where I have to do so much with regards to my project, and with the other activities or the other departmental work which is ongoing, will I be able to do it? If yes, well and good. If no, try and sort those activities to some other areas. Because unless you do this Gantt chart, you would not come to know whether that's happening or not. So therefore, after you've made the Gantt chart, revisit it and see if any of the months, are there too many activities? Can I shift those activities to some other month? Or are there any other month where there are hardly any activity? So can I shift some activity in that month? So these are the advantages of doing Gantt chart at the beginning of your project. But mind you, as soon as you proceed with your project and you start achieving your task or activities, you can always modify the Gantt chart. For example, I have written here that EC approval will be obtained around mid-December. But it so happened that for whatever reason, I was not able to get EC approval here. And instead, I got approval in Jan. Then what happens? I have to modify my activities and push everything forward. And then maybe somewhere, or maybe I have to sacrifice my vacation and work in vacation, whatever way, because the end date here is fixed. Nobody is going to give me any leeway to do, not to do project presentation or poster presentation other than November 2022. So then I need to refine, revisit and modify my Gantt chart. That's one more advantage of having Gantt chart at the beginning itself. Sometimes I can also put a dark line when I revisit. That means this tells me that these many activities are being already done. So I am here now in my project. When I revisit in June and I say, okay, fine, I am bang on the target. I have finished whatever activities are there here. Okay. And now I would concentrate on this area of the Gantt chart. That this dark line, you can do it later if at all you want to do it. I'm just telling you different ways of using Gantt chart to your advantage. Okay. So again, the same process, breakout room, but for 15 minutes, self-managed roles. What are you going to do? Because after breakout and after the presentation, we may stop the session. So before I'm announcing the assignment, you have to submit duly filled project handbook by 20th of October on the learning module. So each group, there are 2 groups, there would be 2 project handbook submitted, and you have to give each other suggestions and comments. Also, now you have to start thinking about individual project on which you are going to work, or you are going to take up that project for this particular fellowship. So start thinking or start identifying the problems which are there in your particular context and on which you would like to work on. So before we move on to the breakout rooms, and in the breakout rooms, this Gantt chart making is very, very simple. So one of you can actually start making it on the Excel sheet. First column, you have your task, and the column above, you can have the timeline Either divide it into 15 days, or for the want of time, you can divide it into 1 month only. Okay. And then when you come back, you can share that Excel sheet so that everybody is able to see your Gantt chart. So before we move on to the breakout rooms, any questions? Have you all used Gantt chart before?
No, ma'am.
Ma'am, I have
No,
a
ma'am.
question, ma'am.
No.
Ma'am,
Yeah, go ahead.
We will show them
ma'am,
how to
when
use.
we
Actually, it's a
assign the
dynamic one.
activities.
Dr. Shilpa wants to ask some
Yes,
questions. Yeah, go ahead.
yes, ma'am. When we assign the activities, that has to come from the project methodology step by step.
Yes, yes. Now you have your evaluation matrix in front of you. So now you know
Yes, ma'am.
what all different data source collection method you're going to incorporate in your project. So then accordingly, you have your methodology. Okay. Few of the points would be common for most of the project, like taking EC permission. It would be there. It would be there for most of the project, right? But the other than that, activities and the end of your group would also be the same, presenting a poster, right? But the other activities would be specific for the specific project. Okay.
So in this case, we work moving forward, madam, with the specific date, or sorry, moving backwards.
Moving backwards. It is most of the times, even if I say forward and backward planning, most of the times when we actually sit and make the Gantt chart, it is mixed. We know the deadline, but then we start.
Okay.
It's a mixed kind of a thing. When your mind starts working, it's mixed thing. You have a deadline, but still you start working from day one.
For this project, what is the deadline we should take it as?
For this
Endpoint?
now, take it as for this session only I'm saying, otherwise Nagda madam will take it as July 2024. July 24.
Okay.
Yeah.
Yes.
For the session.
See, you will be selecting the topic, what you want to work, what you want to see the change in the institution. You'll be coming with us with your idea, initial idea. And then we will ask you to go ahead and make all the questions that Ashwini taught you, and then come back again. After the 1 or 2 presentations, you are on track. Now you know how to collect the data, from where to collect the data and all. And that's how you're going to do it. But don't worry. And Gantt chart, how to use a Gantt chart. There are lots of, but we will also show you next time. Resources are there. Just click on Excel and read Gantt chart on Excel. And you can, on the left side, you can make the cells in such a manner that you write all the tasks. And then select that Excel cells to tell you that. It's not very, and it's dynamic because you can keep on going. If the date is not of these ethical committee meeting doesn't take place, you can postpone it. You can make it with somebody, some other color. It doesn't matter. But ethical committee permission, once upon a time, they used to give a ethics waiver. I have taken ethics waiver for many of my educational projects. But now they don't give you ethics waiver because, on the contrary, last year, one of the participants, the principal was not allowing him to do the project because he said that students are involved, they are very vulnerable, and this will be done, that will be done. Later on, I told him, speak to him and tell him, sir, you only give idea. So he became little softer. And after 3 months of struggling, he said, go ahead with the project. That person did the project. Actually, I would have told him to change the topic, but I thought he will learn the negotiation skill.
Okay.
Madam, there is something called as expedited review if there is no intervention.
Can we discuss this, because this is out of the scope of today's session, I believe, ethics, right? So can we have the breakout rooms now for 15 minutes?
Samek?
Okay, madam. Yes.
And 15 means exact 15 minutes, huh?
Okay.
Yeah. Okay. So group 2 for a change. So have you prepared gang chart on a Excel sheet?
Ma'am, actually, we have taken the Excel sheet and we have listed it out, but the proper designing is not there.
That's okay. That's okay. Can you share your screen? That's okay. Perfectly fine. Yeah.
Ma'am, are you able to
Go
see this?
Yes. Go ahead.
So preparation of protocol is by October 2nd week. Ethical clearance in the month of October itself. OSCE topics and OSCE station decisions by 3rd and 4th week of October. Training sessions for faculty in the month of November. Testing of the stations also will be done on the month of November. Incorporating the OSCE in regular teaching in the month of December. And applying the OSCE in the first internal, that is going to be happening in the month of December, second internal in March, and third internal in May. Analysis of the result in May, questionnaire to students in the month of June, and submission of the project in the month of July.
Okay. So very good attempt. I understand there was short of time. You couldn't actually make the gang chart, but you do know that the time which is there as a column, you have to make it in a row, right?
Yes.
And then you
Yes.
blacken the square so that bird's eye view gives you the whole idea about how your project is going to go about, right? Any
Yes.
comments from the others? You can
Madam,
also think of month of November, which is going to be vacation.
yeah,
Because Diwali is there in the month of November. So you have to think of all those things when you're making the gang chart. So
Yes,
you
ma'am.
put two important activity, training sessions for faculty. Most of the faculty would be on vacation that time, and testing the stations. If you want to test the stations in students, then students do have students vacation, right? So then
yes.
while planning, you may have to do slight modification.
Yes, ma'am.
Okay. Is there any step which is a milestone step you feel?
Ethical clearance.
Ethical clearance. Okay. Do you feel any step which is interlinked or interconnected?
Incorporating the OSCE in their training and applying it in the internal.
Okay. Okay. I'm not yet understood what do you mean
conducting
by
the
incorporating OSCE in regular teaching?
Not regular teaching, madam. Actually, what we thought was that students should be told that or introduced to this method of evaluation because it is for the first time it is being introduced. So
Okay.
we would just introduce the method of evaluation to the students.
Okay. So you would
during the regular practical hours,
sensitize
we will be introducing.
the
Yes,
students about
That's
OSCE
Exactly.
methodology.
Exactly.
Okay. Fine.
Yes.
Fine. I think it's a good attempt, very good attempt. But again, you yourself must have felt that unless you do a good literature search, you cannot go ahead with a project. Okay?
Exactly.
Yeah. Yeah. Okay, fine.
Shall I stop sharing, ma'am?
Yes, sure. Yeah. So group 1, were you able to make it on a paper?
Yes,
Due to
ma'am.
lack
Actually, I have
of-
roughly written it, but we have not prepared this time schedule, ma'am. We have only written the task what we have to do.
Okay, okay. Can you share it? Can you
Ma'am,
click a picture and share it?
okay, ma'am. I'm just sending it.
Yeah.
Ma'am, actually, I've sent it in the group. Can I read it out?
WhatsApp group?
Yeah.
Okay. Yeah, go ahead.
We have to prepare the proposal, then the ethical committee approval, then train the other faculty member for the language, local language, then language classes for the undergraduate students, then construct visit of these undergraduate students to the clinical room, then design the questionnaire, then plan schedule for the language education classes, subsequent demo, and then the visit. A little bit confusion is there, ma'am, because we have kept in point 4 as the language classes, then in the
So you have to think, how are you going to go about? So before you comment, just a quick, because I could see the paper here. You've said design the questionnaire. Whatever material you want to design, everything needs to be submitted for ethical clearance.
Okay.
So your designing the questionnaire would happen before you send it for ethical clearance.
Okay. Okay, ma'am.
Because ethics committee would want to know what sort of questions you're going to ask your students. So that all becomes your methodology, the protocol development.
Okay. Okay, ma'am. And once the ethical committee committee approval is there, then we can plan the schedule for the language education classes, then give the demo, and subsequent visit of the students to clinical rooms so that we can test them how they're interacting with the patients in the local
Can you
language.
all see I shared the screen?
Yes.
So
Yes.
Mirna,
Yes, ma'am.
talk means you want to make the staff members incorporate them into your idea. Yeah? Yeah. So want to sensitize the people around you.
Yes, ma'am.
Before you prepare the proposal, you
Mhm.
need to have a little clarity about many things. Huh? Ethics
Okay.
approval comes much later.
Okay, okay.
Informing the faculty members that they're ready, and then need-based assessment. If you want to do a small need study, then you
Mhm.
said language class. How will you conduct? Who will conduct?
Okay, ma'am.
And design questions. See, the questions could not be compromising to these students, no?
Mm-hmm.
And what is this fifth point?
Actually, ma'am, we have actually followed the chart given by Ashwini ma'am, so that's why it has got jumbled up, I suppose.
No problem. No problem. It's a good attempt.
Ma'am, we'll rectify it, send it one more time to you, ma'am.
Yeah, and try. We will show you next time how to do it directly on Excel. It's very easy. There are many.
It is very, yeah.
Yeah.
For that, only thing is you should be very, you can stop sharing, you can stop sharing, Mirna.
Okay, ma'am.
I was sharing.
Oh, sorry, madam. Sorry. So, see, it is very easy to prepare the Gantt chart. Once you know your methodology, just open Excel sheet. First column, you put down all the list chronologically. Top, you have your timeline, and then start assigning. You can have color codes. It is your own, what do you say, how you visualize things, own creativity, so that you understand, your team understands what your project is all about, looking at or giving a glance to that particular sheet. You know where you are and what you are trying to do. But when you're writing the methodology, do visit or revisit your evaluation matrix and see that whatever indicators, data source, and data collection methods you have written in your evaluation matrix are getting translated in your methodology. It should not happen that you've written their questionnaire, but you've forgotten in the methodology the questionnaire. Okay? Are you getting it? And of course, like you submit to the any other EC clearance, you have to write methodology. It's not that कि educational project में Gantt chart दे दिया तो methodology नहीं लिखने का. It's not like that. You have to write the methodology in words that I would be taking EC committee permission, blah, 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 blah. Okay? Gantt chart is not a substitute to your methodology writing. I hope it's clear. नहीं तो बोलेंगे अश्विनी मैडम ने बोला गैंग चार्ट लिख दिया, मेथोडोलॉजी लिखने का जरूरत नहीं है. It's not like that. You have to write methodology in those many words. Okay? But we have not incorporated the methodology writing because it's not something different from your clinical project. It's the methodology, what you're going to do. In simple words, you have to just write. I hope I'm clear.
Yes,
Yeah?
ma'am.
Yeah, madam.
Any questions? Anything which you have not understood from today's session? Let me remind you of the 2 assignments. One assignment is on the current project. You have to work in team and submit that project on your learning platform by 20th of October. Okay, that is the handbook. And give comments and suggestion to the handbook submitted by the other group. That's one assignment. And second assignment is now start thinking or identifying the problem in your own context on which you would like to work as a project for this fellowship.
And that project, you should be, timeline we will give you, that at least after Diwali, your project selection, your idea should have gelled. And then you can have a small presentation, what you want to do with 5 minutes. That will be just initial.
Correct.
Then
Correct.
you will again be present. See, we are going to also have a talk. Dr. Amol is shifted his college. You know about that.
Yeah.
Yeah. So he said once he reaches Nagpur, he will talk about qualitative analysis.
Amol is not in Gujarat anymore?
No. He has
Okay, again
got
shifted.
he shifted to AIMS Nagpur.
AIMS Nagpur. Okay.
It's a government job. Now it's better paying also.
Yeah.
So he just left couple of, last week. Last week was his last date. So that is one. And also, I want you to find out now, what is Gantt? What is the full form of GANNT? GANNT. How did it come into existence? Who proposed it? Was it used in the corporate world first or educational world first? You have come to know with Ashwini's thing that it's the general chart. It's called a general normalization of the activities. But it's the question is, you must be curious as a teacher, so that the students ask you questions, you can always say, I look into it and tell you later. But when you know it, the students really feel also happy. So we try as much as possible to be having that querying mind, So that is one thing. Secondly, I wanted to tell you, next week we'll be taking on teaching learning, because Ashwini's 3 sessions for present has given you a full idea. But she will again join us maybe end of November or beginning of December, whenever we tell her for the project. And there will be project presentations by you. And I want you to now, I last time also told you, gave you a task that 17th August we started. So put the date, which date, what topic was taken, and one line on what you learned. Only one line. And that should come on the WhatsApp. No one has given me everything. Some topics are missed.
Can I leave the meeting, madam?
Yeah.
Thank you so much. Thank you so much. And you can
Ashwini.
always
Thank you
ask
so much.
the query on the group. Okay? Yeah. Thank you.
Yeah.
Thank you, ma'am.
Actually, even we are leaving, but I'm just wanted to tell you that be on the topic, be on what you have done, keep on recalling. Gaurang last time told you that short-term memory to long-term memory, it has to go. So if it has to go long-term memory of all these things, what we have discussed, each topic will be forgotten as a new topic comes. Don't allow that to happen. Okay? And there are lots of YouTube videos on Gantt, but don't get confused. We will show you simple method next time. It is just that you put the activities on the left side, color the cells as you require, and make it dynamic on the Google, so that it is easy for you to retrieve it, to show it to others, and timeline realistic. ऐसा नहीं कि 1 महीने में सब हो जाएगा. Student thesis करते वैसा नहीं. Even they should be taught regarding how the timeline is made, right? So I want you to be on the task. Okay? Yeah? Anything you want to ask me?
No, ma'am. Thank you.
Yeah. Okay. Good night.
Thank you, ma'am. Good night.
See you till
Thank
next
you,
month.
ma'am.
Thank you,
Teaching
ma'am.
learning
Good
we are
night.
taking next